Study reveals rising depression in South African young adolescents by Satori News. Alarmingly, one-third of young adolescents in the Western Cape of South Africa are displaying symptoms of depression. This is according to a recent study focused on children between the ages of 10 to 14, an often overlooked demographic in terms of mental health research. The study, which brings attention to a critical public health issue, was conducted in 10 primary schools across under-resourced areas of Cape Town and the Cape Winelands, reaching a sample of 621 adolescents. The results shone a light on the worrying prevalence of depression symptoms, which are affecting 33% of the surveyed group. Furthermore, 21% exhibited signs of anxiety. Considering that mental health issues often emerge during early adolescence, the study's findings underscore the urgent need for widespread and proactive mental health support among the younger population. Participants were selected based on their enrollment in the target schools, their age, their assent to participate, and the consent of their caregivers. Through a tablet-based survey, the researchers gathered extensive information on mental health symptoms, as well as experiences with bullying, substance use, and domestic violence. The majority of the participants were female, with many living in single-parent households. The research team evaluated depression using the Patient Health Questionnaire for Adolescents and anxiety symptoms with the Generalized Anxiety Disorder Scale 7. The correlations discovered between these symptoms and experiences such as alcohol and drug use, witnessing domestic violence, and the pressures associated with schooling levels are particularly worrisome. Bullying was reported by an overwhelming 80.5% of students, while 78.6% had witnessed violence at home. The majority of adolescents were bilingual, indicating a diverse cultural background within this demographic that should be an essential consideration in the creation and implementation of tailored support programs. Addressing the urgent needs highlighted by this study, the local researchers are piloting the World Health Organization's Early Adolescent Skills for Emotions program. It's designed as an accessible intervention program for adolescents and their caregivers to be facilitated by non-specialist providers, aiming to foster significant improvements in mental health. This study is a critical step toward recognizing and addressing mental health challenges faced by South Africa's younger population, advocating for comprehensive mental health support services and early intervention strategies within the school system to address and prevent these significant health issues. Thank you for choosing Satori News.